Frequently, patients will report to the clinic with chronic low back pain associated with a secondary disc-related disorder, and more specifically, an internal disc disruption, whereby flexion is most painful. In many cases, we will see a pattern of flexion most painful, hypermobility at L4, L5, and a hypomobility at both L5, S1 and or L3, L4, adjacent to the pain-generating segment. To treat this problem, we will incorporate joint-specific mobilization to either or both L5, S1 and or L3, L4 to improve the movement of those segments in the direction of flexion. So anytime a patient flexes, they'll be able to move more at those segments and reduce the load on the disc at L4, L5. Let's first look at mobilization of L5, S1, and we'll begin with local traction. In order to produce local traction at the L5, S1 zygapophyseal joint, and therefore improve the mobility at that segment, we will incorporate a rotation. We can see on our subject that for the right L5, S1 here, in order to produce a local traction perpendicular to the orientation of the joint surfaces, we're going to use a right rotation. So ultimately, we're going to right rotate all of the segments and use the rotation as our mobilization force. Well, in the L4-5 segments and segments above, we'll first want to preposition them away from their pain. So because flexion hurts, we're going to use extension. Now, in the L4-5 and segments above, because they're extended and right rotated, we will first add to the extension a right side bending. And in so doing, locking those segments at L4-5 and above. In the L5-S1 segment, they're going to be neutral between flexion and extension, and in right rotating, they will simply move in the direction that they naturally course for side bending.